Hello, lovely audience. Welcome back to my YouTube channel. I am so excited to be back. Thank you for tuning in again. Today, I'll be taking you through myths and misconceptions of hypertension, aka high blood pressure. Before we go into today's video, please like, comment, subscribe. Please subscribe to this channel. Thank you very much, and please watch the video to the end. Thank you so much for tuning in again. So let's go straight into today's business. Myth or misconception of hypertension. The first thing on my list of myths here is that people say hypertension is a disease of the aged or disease of old age. This is what many people think or say, that once you are not old, you are unlikely to develop hypertension. But this is not entirely true. Hypertension can occur at any age or any time in your life. You can develop the disease at any age. It's not only a disease of old people. Although, as you become old, your arteries naturally soften. That does not mean that you cannot develop the disease at other ages. And there are even old people who don't develop hypertension as well. So this, you have to take care of yourself at any age. Don't say that hypertension is a disease of old people, so I'm unlikely to develop the disease. Even recent studies have shown that hypertension is becoming more and more common among young people, and that is because of the kind of lifestyles people are living nowadays. The smoking, the taking of excessive alcohol, eating junk food, the pizza, the rest of those things, they increase our rates of getting the hypertension. So more and more young people are developing the disease at a very younger age. So this is not entirely true. The second thing on my list is people say hypertension ran my family, so there is nothing I can do about it. This is not also entirely true. I hear people say this, that anyhow I take care of myself, so far as my parents have hypertension, I will definitely develop the disease later on in life and those things. But this is not entirely true. Even though when it's run your family, when the condition run your family, you are likely to develop it. You are at higher risk than somebody who doesn't have hypertension in their family. So what you have to do is you have to live a healthy life. You have to take care of yourself to prevent yourself from getting the disease. You have to exercise, you eat healthy diet, you maintain a healthy weight, you avoid things that will increase your risk of developing the hypertension, like smoking, taking of alcohol. Those things will increase your risk. So if you avoid those things, overweight, eating unhealthy diet, they will reduce your risk of developing the disease or even prevent you from getting it at all. So this is not also entirely true. The next thing on my list is people say when my blood pressure becomes normal, I can stop taking my medication. This is a no, and this is because hypertension is a chronic disease. Once you are diagnosed of it, you have to take medication for the rest of your life, because it doesn't have cure. It's just like any other chronic disease like HIV, diabetes. It's a lifelong disease, so you have to even prevent yourself from getting it in the first place so that it will not become a problem for you. Your medication, you have to be on your medication. Once you stop taking your medication, your blood pressure will shoot back up again, and that will become a whole lot of problem. This might lead to greater problem again. like when you stop taking your medication and your blood pressure shoots back up, it can lead to heart failure at once. It might lead to stroke. Your organs might damage. These are some of the things that it might do. So you have to take your medication. Once you are diagnosed, you have to take your medication. So prevent yourself from getting it. The next thing I would like to tackle is this, and this thing is not only about hypertension, many diseases. Taking other medication meant for other people. Hypertension is the cause of hypertension in individuals varies. Somebody it might be caused by high cholesterol level. Somebody too, it might be caused by a defect or something. There are many causes of hypertension. So the medication given to other people is not meant for you. You have to go to the hospital, you'll be diagnosed, and then they will know what is your cause so that your doctor might give you a proper treatment. Even though if you take someone treatment, it might work for you, but that does not mean maybe your dosage is not supposed to be the same. So you have to go to the hospital, please. So this is another thing people do, and it is not the right thing, or this is what people think. The next thing is that, and the next misconception on my list is that people say, if I don't add too much salt to my food, I don't need to worry about sodium. Okay, so how sodium come into this thing is that sodium is one of the minerals in the food we eat that is likely to increase our risk of getting hypertension. So, and then this sodium is high in the table salt we eat. So people think that if you take too much salt, you are likely to develop hypertension. Even though that is true, but we shouldn't be worried about the table salt alone, because this sodium is found in other things like canned food, pizza, bread, and all those things. So the next time you are going to buy food, you have to check the sodium content in it. Don't worry about only the table salt. You have to worry about everything you eat, because sodium might be high in other things you eat as well. So this is another misconception of hypertension. The next thing, the last thing on my list is that, and this is a bit funny, because people say hypertension is common in men than women. This is not entirely true. And this is because hypertension is common among men before menopause. But after menopause, women also become at higher risk of developing hypertension. Hypertension is common in everyone, whether you are a male or a female. You just have to take care of yourself. Hypertension you can be affected by the disease. It doesn't matter. So don't say I'm a woman, so I'm at a lower risk than a man. When you attain menopause, after menopause, you are at higher risk, or you are the same risk as men of developing the condition. So these are some of the misconceptions or myths of hypertension I wanted to talk about today. And these have been so exciting. It has been exciting making this video. Thank you so much for watching the video to the end. I am so grateful. Please leave a like, comment, subscribe, and please share the video. Thank you, and please stay in tune for more exciting videos. Thank you so much. Thank you. Bye.